I think we need to destigmatize this whole notion of HIV testing being something taboo. I mean, we test for things such as diabetes, for hypertension. You know, we need to make this a routine test to make it available for individuals to be seen as something routine, something that's treatable and manageable to stop the potential for onward transmission to others.
The sooner you know, the less risk you are to yourself and to others. And also you can begin that process of understanding, because there are so many illnesses out there. You know, I might have diabetes, I don't know that. I might have some kind of cancer, I don't know that. But if I have had a screening for any of those illnesses, then I'm going to be better prepared for the kinds of things I need to do, or not do, but at least monitoring things helps.
The trouble is we're all individuals. I think people should be tested. I think they should get in the system as early as possible, whether they start treatment as early as possible. I think the jury's still out. And I personally have concerns of people that don't want to be tested, but it was very interesting. I met up with an ex of mine only last week who I haven't seen for 18 years, who is a nurse. And we've not really had any contact, now lives overseas. And we were having lunch and we were talking about my HIV disease and what it's been like for me. And I remember just saying in passing, have you been tested recently? I assume you've tested. And he said, I haven't had a test for a long time. I don't want to because I don't want to know. And I sort of, at one level, understand that. But as I tried to explain, it would be so much better for you, I believe, if you were tested in the system.
The suggestion that people should have a test on a regular basis without then saying, because if you are tested and you are found to be positive, these are the things that you might want to do. And because if you are tested and you are negative, these are things that you might want to think about. The benefits of early testing, that needs to be explained. And, you know, your information television programs need to be doing that. Your radio programs need to be saying that, because at the moment, I don't think there's a lot of publicity out there.
Hombre, yo creo que sí, y más como está la cosa hoy en día. Sí, nunca está de más y yo sí que lo recomiendo.
It's very important to test for HIV because you must know your status early before you got sick. Because if you go to the clinic or hospital and tested for HIV when you are already sick, it's not good, because that might be late.
It's very, very important, and I think in Italy especially we need a new different kind of culture about it, because we speak about the virus a lot 10 years ago or 15 years ago, but now it's something totally forgotten, and is a big mistake. We need to speak about tests also in the school and speak about it everywhere.
When people are given an informed choice with regards to testing for HIV and about the benefits of early testing and about saving the immune system as much as we can and the potential of going on in treatment to save their immune functioning as well as to stop the potential for onward transmission, it's a good thing, and that individuals would be more than happy to go ahead to pick that up. If they were being tested in an A&E department or an acute medical unit for other certain blood tests as well, one extra tube of blood and being explained about the benefits of this would, in my opinion, would not be that difficult for individuals to digest.
Regular HIV testing, I think, it's going to be very helpful, because people will tend to know their status, and once they know their status, they'll know how to behave. They'll change maybe their sexual behaviors, and they'll know how to play the sexual behavior procedures safe.
We find out that women, they don't have power over men, but once you know your status, you feel that you regain the power to tell your partner also to know his status and also to practice safe sex. So that is something that you develop within yourself. So I'll say yes, testing regularly helps.
Most of the people, they're scared to go and get tested. Yeah, they say no. I don't want to go and get tested because maybe I'll find that I'm HIV positive, and after that I'll be depressed. It's fine not knowing that not knowing your status, just live like that, which is very bad.
One thing somebody said to me when I was first diagnosed, and I think it is 100% right, is it is dealing with the psychological aspects of this disease is far harder than the physical side. And I think that's right. I was a fairly together person. I had lots of support. It was easy in that sense for me to say, I'm HIV positive, I've got to get on for it. For some people, it is a piece of news they never really recover from or cannot get their head around.